President Trump is urging Republicans in the Senate to act on the health care bill the House passed last week, but some Republicans say they plan on starting from scratch.
I believe this is going to be a better product, and by the time that people see that the premiums are lower, that it's a better service, there are more options and more choices, they're going to reward the Republicans that stood up and said, we're not going to see the Obamacare system, which is failing and collapsing, continue any longer. We're going to do something better, and we're going to do our job as legislators to get this thing done.
The bill that passed out of the House is most likely not going to be the bill that is put in front of the president.
Obamacare is collapsing. Obamacare isn't working. What good is Obamacare for anybody, let alone a person with pre-existing conditions, if you don't have a health insurance plan that you can even get? So this is a rescue mission to make sure that we can achieve the goals we all want, which is getting the cost of coverage down and making sure that everyone has access to affordable health care, especially in including people with pre-existing conditions. That is what our bill does.
The House bill is not going to come before us. The Senate is starting from scratch. We're going to draft our own bill, and I'm convinced that we're going to take the time to do it right. Speaker Ryan today said that he hoped that the Senate would improve the House bill. I think we will do so, and that we will come up with a whole new, fresh approach that solves the legitimate flaws that do exist with the ACA, where we've seen in some markets insurers fleeing, so people won't be able to buy subsidized insurance, but it will also keep some of the benefits of the ACA.
My position is, and I believe this is the Democratic position, don't repeal Obamacare. Take those sections, like the individual market, which has some problems in it, and deal with it and fix those sections. And it can be done.
I think what's happening is not dead on arrival, not taking the House bill and bringing it immediately to the floor, but taking what the House was able to do, looking at that carefully, and coming up with what the Senate thinks the Senate can do. You know, this is the way legislation used to be passed.
All right, John Wagner is in Washington. He's a White House reporter for the Washington Post. John, thank you for joining us.
Oh, thanks so much for having me.
You co-authored a piece on Sunday titled, "As Some Republicans Rush to Defend House Health Bill, Senate GOP Warily Pauses." Now, so John, as we just heard there, and as you lay out, a growing number of Senate Republicans are recasting the president's celebration as a starting point, while the administration and other Republicans are in many ways digging in on the House bill. So what does this all add up to, and does starting from scratch seem like the consensus point from the Senate at this point?
Well, I think that's right. You're seeing somewhat of a split screen, or at least you were over the weekend, where Republican leaders in the House and White House officials who are very involved in pushing this through the House feel like they have to defend the product. There's been a fair amount of criticism, as you know, about what this means for people with pre-existing conditions. There's a lot of controversy over what this does to the Medicaid expansion of recent years. So there's been a lot for those folks to defend. I think on the Senate side, they want to start fresh. They want to, have a product that is free, at least initially, from the criticism of the House work. And we'll see, how much of a different direction it goes. But I think at the end of the process in the Senate, you'll see something that looks at least a little bit different. All
right. So what are the points of anxiety we've heard senators express concern over?
Well, I mean, there's a lot of talk about what this will mean for people with pre-existing conditions. I think that's been the biggest issue in the last couple of weeks. And the House leaders have tried to be reassuring that they've put in some more money into the bill to shore up premiums for those with pre-existing conditions. Critics say it isn't enough. And frankly, it's hard to know, because the way this bill works, governors can opt out of the existing system, and no one is really sure to what extent governors will opt out and what that will mean once they do.
All right, John, help us understand how Senate Republicans compare to their counterparts in the House. Considering the type of leader Mitch McConnell is, how will this process be different than what we've seen in the other chamber?
Well, there are a couple of things. You have a very narrow margin in the Senate. The Republicans hold just 52 seats, so they don't have a lot of wiggle room there. And the Senate leadership has appointed a working group, so they're going to take some time, and I don't think anyone's too inclined to rush them to come up with their own product. And then there'll be some give and take. So we'll see where that goes. We'll see how much President Trump wants to weigh in. He was very active with the House toward the end. There's a different dynamic in the Senate with Leader McConnell. So there's a lot that, frankly, we're just going to have to wait and see how it plays out.
All right, we've also seen a number of Democratic senators come out and criticize the fact that the Senate's working group on health care is comprised of all men. Could we see calls for more diversity in that group grow in the coming days?
I think so, especially once it actually gets rolling and is doing its work. I mean, the response from the Senate Republican side has been that this is really about policy. It's not about identity politics. But it is a fairly stark picture when you look at the lineup of who's working on the bill.
All right, finally, John, advocacy groups are already running ads against Republicans in vulnerable districts who voted for the GOP bill. I want to play an ad targeting Congresswoman Martha McSally, whose Arizona district Hillary Clinton won back in November. Let's listen.
Congresswoman McSally just voted for a disastrous health care repeal bill opposed by the American Medical Association, AARP, and the American Cancer Society. McSally voted to raise your costs and cut coverage for millions, to let insurance companies deny affordable coverage for cancer treatment and maternity care, and charge 5 times more for people over 50. McSally voted yes, even though the bill makes coverage completely unaffordable to people with pre-existing conditions. Congresswoman McSally, how could you do this to us?
All right, John, it's clear we have seen how this issue is already bubbling over at town halls. How impactful can ads like that be as we look towards midterm elections?
Well, I think we'll get to find that out, because I think this is probably the first wave of many to come, particularly against Republicans who are in swing districts, some of whom would at least confidentially confide that they weren't thrilled with this bill, but this has been a campaign promise for House Republicans for so long that many of them calculated that the cost of failure to pass a bill would be worse than the blowback they might get from passing a bill that isn't perfect.
All right, John Wagner in Washington. John, thank you.